So, hello, my name is Daniel Wolfson. Today I'm joined by Lisa Letourneau, Executive Director of Maine Quality Counts, as well as Kelly Slate-Kavovich, Senior Project Director with Maine Quality Counts, to talk about choosing wisely. Maine Quality Counts is one of a number of organizations funded by ABIM and supported by the Robert Wood Johnson Foundation that's working to advance the Choosing Wisely campaign. Lisa and Kelly, thank you for joining me today. Could you describe what Maine Quality Counts does and what your mission is?
Sure. So I'll start out. The Maine Quality Counts is a regional health improvement collaborative, which means that we're an independent, nonprofit, multi-stakeholder group that brings together all the stakeholders in healthcare. So not only providers and patients, but also payers and community groups, public health entities, employers, really trying to bring everyone together to address some of the big issues that we face in healthcare today.
So why did you choose to get involved in Choosing Wisely?
We saw it as a really important opportunity to try to get at some key aspects of both improving the quality and safety of healthcare and fostering better conversations, partnerships really between patients and their healthcare providers. And then importantly, our board has really urged us to get more in the game around helping to control healthcare costs and helping people to better understand how to control their own healthcare costs. We have several strategic priorities as an organization, two of which include providing assistance to healthcare providers to improve the quality and the cost of healthcare, and another to engage people meaningfully in improving the healthcare system. So this really spoke to several of those strategic priorities and provided a good opportunity to advance this work. We also were fortunate to be a grantee of ABIM in the first round of Choosing Wisely, so had started out some of these efforts and really had a chance to spearhead some of the efforts around spreading Choosing Wisely in Maine. So this opportunity, when it came along, was just a great opportunity for us to continue and expand our learning in this area.
So my next question revolves the second initiative that you're involved in, the second grant. Could you describe that initiative?
Sure. Why don't I start out and then Kelly, I'll hand it to you. So,
Sure.
In the first round of Choosing Wisely, it was all about trying to raise awareness with providers and a little bit with the public about the Choosing Wisely initiative. And I think we had some good success with that. Also, under our Maine State Innovation Model, we had an opportunity to do more work with providers on the ground about how do you put Choosing Wisely in practice. And after several rounds of this work, several of the providers came back to us and said, hey, this is great, but we get it. You know, you don't have to keep pushing us on this. We get it, but geez, we're facing every day patients who come in expecting this test, that pill, this procedure. So they urged us, gosh, go out there and work in communities and really try to work more on the people side of this to help them understand that they don't need all these things. So seeing this, we said, great, let's look for an opportunity to do this, but we can't do it statewide. So let's try to do it in one or two communities. And because we're quality counts, we couldn't do one, so we had to do two. So that's where we came up with the idea of working deeply in two communities. So, Kelly, let's take it from there.
We are trying to work together with community partners and lead healthcare providers in those two regions. And so in the Bangor region is one of our regions, and then the Mid-Coast, which is comprised of Bath and Brunswick, we are working with noted lead healthcare providers in each of those regions. Up in Bangor, it's St. Joseph Hospital and Penobscot Community Healthcare, and in Brunswick, it's the Mid-Coast Hospital. And then our lead community partners, where we really need to connect with other community partners, whether they be in public health or educational or civic or faith-based groups. And the lead with our community partners are Eastern Area Agency on Aging up in Bangor, and then in the Mid-Coast Bath area, Brunswick Bath, which is the Mid-Coast area, we are working with Spectrum Generations as the lead to help roll this out into the community. We felt that we really needed to saturate the community with messages that resonated with all types of people, and the only way to get into that community is to work with those already in it who connect with their own community members. And with that, having the lead healthcare provider who also are involved in community events, such as one coming up with flu clinics, integrating the Choosing Wisely messaging in one aspect of what's happening into the community. this really is more of a community organizing opportunity for us to really get at changing the culture of health, getting people to understand what getting the right care at the right time is, to help us reduce the use of antibiotics, benzodiazepines, and imaging for low back pain, and helping them become more empowered about asking the right questions that go along with choosing wisely.
What's new and innovative about your approach, particularly in the delivery system? How are they going to approach the reduction of utilization?
You know, we are trying to build on organizations that have already, again, sort of signed on to the importance of this work. So for them, I think it's both, you know, how can they continue to spread this, whether it's by embedding this choosing wisely tools more in their practice, maybe their EMR broadly throughout their healthcare settings. But to be honest, we really are focusing more on the community side, even within the healthcare system. So the first conversations with the healthcare system are great. Where are you interfacing with the community? You know, again, be it in some of these organizations, or maybe it's in all your waiting rooms, maybe it's in your cafeteria, maybe it's on the video screens in the hospital. But really trying to think with the provider community about how we reach patients, people, public, community. So we're certainly working with those providers to get this into the healthcare system, but it's really about communicating more effectively with patients.
And also getting into the employer community. Like we have Bath Iron Works in the Brunswick area that really want us to start working with their medical team, occupational health, so forth, to help them understand what choosing wisely is, how they can work with their employees in this regard. So it's going to take different avenues. It's like, you know, there's a hub, and then we have all these folks going out into that community to really saturate the message, to incorporate more people than we've traditionally done, and move out into the community and move beyond the walls of the healthcare setting. So,
and I think in that way, maybe, you know, a real innovation for the provider community is figuring out their role in that. You know, how do they serve as effective spokespeople in that? How do they find those points of connection between them and the public, the community, and interact in different ways?
What do you think are the biggest challenges and obstacles in making this a successful campaign?
Well, I'll jump right in.
Sure,
My frequent concern is, what are the messages? So I think, you know, with all due respect to ABIM and choosing wisely, it's been good messaging on the provider side. And what are the messages? What are the taglines? What are the social media messages? What's the way that we can get this message out in a way that sounds appealing to people, fun to people, attractive? You know, if we just think about, it's really social marketing, right? So what social marketing successes have we had in healthcare? What are the words that have been said? You know, how do we get it down so that it's quickly enough communicated and yet builds trust and understanding? And I don't think we know that yet. So we're really looking forward to learning with ABIM and our other partners around this. Kelly, other thoughts?
no, I think you really hit it on the head. I think that one of the challenges we have is how that resonates, and we're working with taglines to see what's going to resonate with our community partners and the general public at large, to make it more jazzed up, to really get people's interest, to say, hey, I do want to find out more about that. Granted, you know, 5 questions, we're looking at this, but we're going to go that extra step to see how we can engage the community at large. And I think the other challenge is building the trust within the community so that we're reaching people where they're at, to help them understand at their level of interest with the healthcare community that what's going to make them become more interested and care about their health and reducing costs and reducing unnecessary tests and treatment. So I think some of those are our challenges too, and how we work with them together.
There are different messages for physicians and patients, and what resonates with them, I think, is really key to make this a success. So what does success look like for you guys?
Well, it's been pretty clearly spelled out, right? By
20% reduction.
So 7% a year.
Right.
In each of those 3 key measures, ultimately, and you know, I think more broadly, a wider understanding, acceptance of this messaging out in the community that hopefully is reflected in those reductions.
Right. To me, success would be going into a meeting or going in and joining a group of people in my community that are talking about choosing wisely. That to me is success, that we are reaching people out into the community. Even like looking at our organic farmers market fair we just had. We went there to see what we could do with messaging Choosing Wisely. So I hope by the end of this project that we will be able to see people talking about it no matter where they live, work, or their involvement is.
You know, I think we did a great.
Tell us more about the fair. What did you do at the fair?
We have a very large common ground fair, it's called, and it's basically organic farmers, and everyone comes to this fair to learn more about different ways to grow food, to cook food, to fiber arts, to anything of that nature, and they have a health and healing tent as well as social political tents and that type of thing. So we thought we should put our foot in this arena, and we did. This was our first year. We were late, but next year we hope to spread our information much further. So it's just getting to where people are.
You physically went to the fair,
Right.
You showed up at the tent, you did your presentation.
I had a great
right?
conversation with healthcare providers who were interested enough to come because they were curious. So hopefully we can change the title or our message so that we can get people who grow food, who can't afford a lot with their health insurance.
We have one of the highest concentrations of organic farmers and small family farms in the country here in Maine, and that's a really important sort of social force in the state and important community. And as Kelly was just saying, they have some of the most to care about in terms of out-of-pocket costs because they tend to have either no insurance or very high deductible plans. So we thought, oh, it'd be an interesting group.
So thank you so much, Lisa and Kelly, for joining me today and offer your work to advance the Choosing Wisely campaign. I encourage viewers to visit choosingwisely.org to learn more about the campaign, the work of our grantees, and for more interviews like this one. Thank you so much.